Hi, in this video I'm going to be talking about X-linked agammaglobulinemia or Brutons agammaglobulinemia. And since it's such a long word, I'm just going to call it XLA throughout the video. Why is it called X-linked? Because there's a mutation in the receptor tyrosine kinase which is present obviously on the X chromosome that causes the disease. Now, since I'm a girl, I have two X chromosomes. So do you think I'll be affected by the disease? Obviously, no, because if one of my X chromosomes is mutated, the other X chromosome can cover up for the defect. Boys, they have an X chromosome and a Y chromosome. So if one X chromosome is mutated, there's no other X chromosome to cover up for the disease. And that is why XLA affects boys only. B for Brutons, B for boys. So, what does this mutation do? It prevents the development and functioning of B cells. There is a block in the transition from pre-B cell to immature B cells. That is why the B cell count goes down. B for Brutons, B for B cells. What do B cells produce? Antibodies or immunoglobulins. And that is why the gamma globulins in XLA is reduced, which is why it is called agammaglobulinemia. Now, this is very obvious stuff, and anyone can figure out all of these points from the name itself. So, the exam is not going to tell you that there's a boy with a low B cell count and has no immunoglobulins and what is the name of the disease, because everybody's going to know that it is Bruton's agammaglobulinemia. So, you have to know the clinical presentation of the disease. Do you think they're going to present immediately after birth? No. And why is that? Because the mommy's immunoglobulins protects the baby till like about a year, and after that the immunoglobulins decline, which is when XLA will present. It typically presents between the ages of 3 to 5 years. These children are susceptible to encapsulated bacteria, mycoplasma infections, giardia infections, cryptosporidium, campylobacter infections, and enteroviral infections. The way I remember this is I remember the types of immunoglobulins that we know of. For example, IgG, IgA, IgM, and IgE, the gamed mnemonic. And then G is for Giardia, M is for Mycoplasma, E is for enteroviruses, encapsulated organisms. Cryptosporidium and Campylobacter are not included in the mnemonics, sadly. Which are the common encapsulated bacteria that you know of? Strep pneumo and H flu. So you should know that these children will present with recurrent otitis media, pneumonia, and giardia infections are common. Will you vaccinate these children? Well, XLA is one of the few conditions where live attenuated vaccines are contraindicated as they can cause overt disease. Can you give other vaccines? Yes, but they will not cause the antibody response required for immunization. On physical examination, they may show absence of tonsils and other palpable lymph. So I have a mini mnemonic for the things that are absent in Bruton's agammaglobulinemia, and that is BRTN. You skip the vowels U and O. So B is for B cells. B cells are absent, and so are antibodies. R is for response to vaccines. That is also absent. T is for tonsils, and N is for nodes. That is lymph nodes. Interesting fact, failure to produce antibodies in response to vaccines was noted by Bruton, which led to the discovery of the disease in 19. Okay, so I'm going to do a quick revision before I wrap up this video. Bruton's agammaglobulinemia is due to a mutation in the receptor tyrosine kinase, It is X linked, that's why it only affects boys. It is characterized by a low B cell count and absent immunoglobulins, and they have recurrent otitis media and pneumonia due to infections with encapsulated bacteria. They may also have predisposition to giardia, lamblia, diarrhea. They present a few months after birth when maternal immunoglobulins decline. Physical examination may show absence of tonsils and other lymphoid organs. Exercise a few conditions in which live attenuated vaccines are contraindicated. The treatment is IV immunoglobulins and antibiotics. That's all. Stay awesome.